We'll now hear from Dr. Wilma Wooten.
Well, while the slides are coming up, I'd like to give a shout out to Nancy Starr and Joanne Julian for helping me to develop our slide deck, and thank you for the invitation to speak this morning to make the dots or connections between health equity and oral health. If you can go to the next slide. So what I'm going to, next slide. I'm going to talk about 3 areas. Basically, I think we're talking to the choir, but just a refresher on what is health equity. And then how has our health department, public health services here at the County of San Diego in the Health and Human Services Agency embedded health equity into public health practice. And then we'll spend the last remaining time with you sharing how any local health department can integrate health equity into its oral health program. Next slide. So we're going to start again, start out with what is health equity, and whoever is progressing or moving the slides, we can go to the next slide. So everyone's seen this screen, and there have been, or this slide, there have been several slides of this nature, but I think this is the one that most aptly captures the whole difference of equality, which everyone has a bicycle, as opposed to equity, which people have what they need based on their physical needs to operate a cycle. So you'll see there's a very tall person needs a larger cycle, or a shorter person that needs a different size cycle, and even a child that needs a bicycle that meets their needs. And then at the beginning of the bottom part of the slide, you see someone who needs a tricycle because they can't maneuver a 2-wheeled bicycle. So going to the next slide. So this is basically a spectrum of health equity, starting out with social determinants of health. And I will not define go through the definitions, because we all know what these are. But my point for sharing this slide is achieving health equity spans a spectrum. We start out with identifying social determinants of health. Then we look at health disparities. What are key health disparities? And when I started working for the county in 2001, health equity was not a term that had yet been socialized. It wasn't until about 2008. So our focus in early 2000s was on health disparities. Then disproportionality became a part of the mix, and disproportionality is looking at services. What services are being provided to a particular population that is greater than the percentage of that population reflected in the general community. Then health inequity, and if we address health inequity, then we can achieve health equity. Next slide. So everyone from the state, we borrowed from the state this graphic from the report that was issued several years ago, a public health framework for reducing health inequities. And it's based on the Barhai, the Barhai model. And it basically looks at social inequities on the far left that can have an impact on institutional inequities. And strategic partnerships are important in addressing these institutional inequities. And policies transcend across the bottom that can have an impact at all levels of this framework. Our living conditions are impacted by social inequities and institutional inequities, and living conditions, whether it's physical environment, social environment, economic and work environments, or service environments, can have an impact on the health of individuals in our communities. So I just love this slide because it really shows how and efforts can be addressed at whatever stage of the framework we look at, whether it's upstream or whether it's downstream, which is reflective more of the medical model. Next slide. And then if we can achieve health equity by transforming the social determinants of health and environmental conditions where people are born, grow, live, work, and age, we can achieve optimal health, mental health, and well-being. And by having healthy people, that contributes to healthy communities, which transcends into a healthy environment, which ultimately creates a healthy society. Next slide. So everyone should be familiar with the 10 essential public health services, which are also the basis for the FAB domains. If you've applied for public health accreditation, or if you are in the process of if you are in the process of looking at becoming accredited by the national FAB body. Next slide. And the point for that slide is equity is at the center. Research used to be in the center of the 10 essential public health services. Now it is in the center and transcends all of the 10 essential public health services. And in the next slide, you'll also see, and you've heard a lot about foundational capabilities. Equity is one of the foundational capabilities and is also transcends all of the foundational public health services, which includes the foundational areas at the top and the capabilities at the bottom. Next slide. And the last concept I'd like to point out is that there are core competencies for public health professionals. And this was updated in 2021, health equity skills for public health professionals. Public health staff is one of the 4 domains included as a part of the core competencies for public health professionals. So again, all of the key public health guidance, documents, and competencies include health equity. Next slide. So now, and this is the actual, again, won't go into detail, but domain 4, health equity skills, includes 7 subcomponents that staff should be familiar with. And so this is included in the PowerPoint presentation, and I encourage everyone to become familiar with these competencies for our staff. Next slide. So in the next, hopefully 5 minutes or so, we're going to share with you what San Diego County has done to embed health equity into our public health practice. Next slide. So in February of 2010, as a proud member of CCLHO, I was asked to develop a framework for how health departments can infuse or embed health equity into their local health departments. So after looking at what at the time was going on as it relates to health equity at the international level, looking at World Health Organization information, as well as federal information from CDC, HHS, looking at regional activities. Bar High was an example here, and looking at other activities across the nation. We came up with these 4 core pillars of or components that needed to be addressed to infuse health equity into a local health department. And this includes looking at the organization, the workforce, the community, and data. And data is both internal and external, even though it says external here. But you have to start first with your organization, taking from or borrowing from the airports when you view when you're about to take off. They tell you to first put the mask on you before helping anyone else. So from my perspective, this is following that same principle. Look at your organizational, look internal first before going out externally, trying to educate the community. So looking at your organization and looking at the workforce, then transcending to the community and looking at data, both internally and how data can impact the community. Next slide. So this is just a slide showing our health equity plan focused on the 4 pillars. And I'm not going to go into details here, but for the organizational and to achieve internal transformation, it really is looking at policies, it's looking at procedures, looking at internal strategies and processes that you have in place. And I always say that you can say something, but it really needs to be documented in the form of policies or narratives that so your words or your actions follow your words. So that's the organization. Then with the workforce, that is focused on training. With the community, it's focused on partnering with the community entities to improve health equity elements or issues or priorities. And then examine opportunities for the community and customer engagement or consumer engagement and partnerships to advance overall health literacy, resilience, and adaptation related to climate change is one example. And then obviously data, we have a very strong community health statistics unit here in San Diego. I know mining data varies from jurisdiction to jurisdiction, but really look at how can you look at the data from a health equity lens. And in San Diego, we utilize the five lenses: age, gender, geography, race and ethnicity, and socioeconomic status when possible. So let's move on to the next slide. In our health equity plan is every 2 years. So I'm going to first focus on organization. I've kind of gone through some of that already. Next slide. So this is a historical timeline of how San Diego has been integrating a health equity, or starting out with a health disparities focus, as I stated, then transitioning to health equity. In 2008, our agency declared health equity as a priority. In 2010, our chief administrative officer declared disproportionality as a priority. And then in 2010 is when we developed the CCLHO framework for health equity. 2015, our Office of Health Equity was established as part of our process of applying for public health accreditation, and our county also launched a diversity and inclusion strategic plan. In 2016, we achieved public health accreditation. And in 2017, we revised our READY initiative by posting all of our educational materials and the various languages that they were translated into on our public health web page. And then more recently, the county has created an Office of Health, I'm sorry, not the county, Public Health Services created we basically renamed our Office of Public Health, our Office of Health Equity, which you saw was created in 2015. We added "and climate change." In addition, the county supervisors declared racism as a public health crisis. And what's not on here is what I think in the same year, the Office of Racial and Social Justice was created. Next slide. So these are just some policies and plans in terms of the timelines that align with the activities from the last slide, but these are various documents that we created. The county launched the first strategic plan for diversity, equity, and inclusion. We published our first health equity policy and procedures document, and then published our first health equity plan. Again, these latter two components were a part of our process of applying for public health accreditation. Fast forward to 2021, we updated our public health health equity plan, and these plans are a 2-year process. And then you see an update of our policy, our third actually health equity plan, and that includes our policy that's shown here. Next slide. So let's focus on workforce. And before we go to workforce, you can see to the next slide. Also, annually, when our county goes through the budget deliberation process, we have public health, or rather operational objectives in our op plan. And that's another place where we put words to the action, where we actually state that our focus is on health equity. So that's included in our op plan narrative for public health services. And in this slide, this is just to provide evidence of the fact that we've created several training series for our staff. We initially started to develop a training for health equity, and then realized that staff really needs to have training on public health in general. So we created this public health 101 series, which includes the history of public health, the public health concepts, data, public health data, as well as health equity 101 and climate change 101. So these are the 5 components of our public health 101 series, in addition to other prioritized trainings that are developed annually or every 2 years and represented in our workforce development plan for our staff. Next slide. So these are just some tools. If you can click again, we developed in response to staff asking, how can I, or what can I do to advance health equity in our program? We created tools to answer those questions along these 12 areas, and I'm not going to read these out. There should be a graphic here. Apparently, if you click one more time, maybe it will show up, but it doesn't. Yes, there you go. So this is a health equity tool for programs that was developed. And in the next slide, we created a health equity tool for individuals. Click the next slide. And so we provided information to staff on individual actions they can take, how can they increase their knowledge, and how can they enhance interpersonal communication and compassion when they deal with staff. So this is basically what can I do as a staff, and there are activities that are defined in this individual, in this tool for individuals. Next slide. So community, next slide. We're going to be ending in about 5 minutes. So examples of partnerships and collaborations with the community, just to know that we've done a lot of presentations in the community. You can click the slide again. These 2 presented to the NAACP with a partner from UCSD. Joanne Julian has given presentations to our community regional leadership teams and other groups in the community. Next slide. So data, I think that's self-explanatory. There's a lot of data out there. Next slide. And I'd encourage everyone to maybe visit our Community Health Statistics Unit, San Diego website. But the focus for this slide is our health equity reports that originally were published first in 2016. And now we update them more frequently by issuing public health briefings, if you will. So you can check this out also on our Community Health Statistics website. Next slide. And so this is just a summary, so I'm not going to go through this, but this is a summary of the four pillars, what we've done in San Diego as it relates to developing health equity plans, work plans, and policies, provide trainings to our workforce, collaborating with community partners and forming partnerships, and sharing timely data. Next slide. So now we're going to move to how can you as a local health department integrate health equity into an oral health program. In the next slide, we're going to follow that same format, looking at the organization, the workforce, the community, and then data. So here for pillar one, develop the infrastructure for your program that's founded in health equity. Examine data to determine gaps and needs, develop a health equity focused vision and mission, and garner a commitment to equitable outcomes for oral health programs, and establish infrastructural components founded in health equity. This again includes plans, policies, develop a charter for any working groups, develop working groups, and generate reports from the efforts of your committees or work groups or coalitions. And this ensures accountability. In the next slide, in focusing on the workforce, develop some type of oral health training that focuses on dental health students, nursing students, and pre-dental students. And we actually did this during spring of 2013. We actually did this. We worked with 2 institutions of higher learning on the importance of oral health in public health and promoting equity, and focused on these 3 populations. Next slide. When it comes to the community, a lot of work can be done here. And these are examples of what we've done here in San Diego. We created, number 1, health observance tools. So in any given month, but particularly in October when there's a focus on National Dental Hygiene Month or National Oral Health Month, which is June, we create these screens or backgrounds. We're virtually, when we have virtual meetings, that you can use to help promote your partnerships and observing these health observance dates. Next slide. We also, on the far left, we also develop communication plans to send messaging out to the community in observance of these health observance dates. So whenever we observe a specific date or a cultural opportunity, we create social media text or Facebook communication strategies to further push that information out to the community to inform and educate them about the particular issue. And in this particular case, it is National Oral Health Month or National Dental Hygiene Month. And another example is and I'm very proud of this, we have an annual oral health forum. We've had our 7th one that occurred on June 4th. 73 participants represented various dental, medical sectors. There were educators and community-based leaders. They all convened to learn about oral health equity and discuss community-wide change. We featured, our featured speaker was Andrew Strong, which is the director of the Office of Equity and Racial Justice that I mentioned earlier. Next slide. And this slide is our promoting, these are 2 documents that we've created. There's an oral health brochure, and then there is a brochure, a 1-page flyer that's focused on helping parents helping to educate them about how to brush the teeth of their children. And we've created messaging promoting these tools as well. And the next slide is, this is one of my favorite events that the county conducts, and that is a community event entitled Give Kids a Smile. COVID-19 changed the way we did this. It used to be one day in the early part of the year, usually February. Because of COVID-19, it occurred across several days or even weeks in a given month. So next slide. And with that particular event, we have dental offices that volunteer to provide free services to those children in need of dental health services. And then on this slide, these are just other examples of oral health efforts that have a health equity focus, reaching out to our rural community, educating our foster care community, and collaborating with organizations that serve refugees and newcomers, and providing toothbrush kits in school meal distributions during COVID-19. Next slide. It's focused on data. Again, these are just some data points that have been generated specifically for San Diego County. And in San Diego County, 1 in 4 children from low-income families, which is about 26%, have used free community or public dental programs. More than 1 in 10 children ages 3 to 11, which is 14%, have never visited to the dentist. 1 in 4, or 25%, have never visited the dentist. Among other county children that are entering school in 2021 with a submitted oral health assessment, close to 1/3 or 30% reported that they had caries. Close to 1 in 4 had untreated decay, and also reported caries experience and untreated decay were higher among these low-income children in low-income communities with less healthy community conditions. And this is 41% and 36% respectively. In the next slide, and I think this will be the last slide, this again is a summary of those 4 pillars as it relates to oral health programs. Again, establishing infrastructure, training future healthcare workers focused on oral health, creating collaborations in the community through forums, conducting or building partnerships to enhance community events like the Give Kids a Smile, and then sharing data so everyone is aware of what potential needs are. And I think that is my last slide. And again, next slide. Oh, these, yes. So thank you.
Thank you, Dr. Wooten.
Yeah, thank you for helping us to advance the health of our community and to get information out about oral health and its importance to San Diego residents. Thank you.
Thank you so much.